and $650 per patio door with the purchase of 4 or more windows or doors. No money down, 0% interest, and 0 payments for 12 months with approved credit. Visit renewalbyanderson.com. Renewalbyanderson.com. Offer ends October 31st. License CGC 1524135.
All right, 25 minutes before 8 o'clock. Thank you for tuning in. If you've ever known anybody who had a heart attack or a stroke, you know that it happens. It can happen like suddenly. And one of the things that we've learned about stroke is that if you do see signs of a stroke and you hurry and get some attention, medical attention right away, it could mean the difference between being incapacitated for the rest of your life or even being dead. We met a guy. We were in Silver Springs in the state park, and a gentleman came up to us, and we were playing music, and he came up to talk to us about the music, and his father was with him, and he said, "Yeah, I just got back from Michigan. We went there because my dad had a stroke," and so his dad was there, and his dad was talking to us, and I said to his father, "Gosh, I can't even tell you have had a stroke," and it was like 4 months early. It wasn't that much ago. Science and medicine has come so far. Dr. Jeffrey Switzer is on the phone. Dr. Switzer is an associate professor, the director of telestroke and teleneurology, and the director of the Comprehensive Stroke Center in the Department of Neurology at the Medical College of Georgia at Augusta University. And I believe on the phone is also Lieutenant General George Crocker, a retired lieutenant general for the U.S. Army, served 34 years, and is also a stroke survivor. So good morning, Doctor and Lieutenant. Thank you for your service, and thank you for being on the air, both guys. Thank you, guys. Good morning.
Good morning. Morning.
Are you both in Augusta right now?
No, I'm in Augusta. The general, I guess, is in Arkansas, correct, General?
Outside of Clinton, Arkansas.
Oh, wow.
North Arkansas.
Wow. So if I could ask the lieutenant a question first. Lieutenant Crocker, how long ago did you have your stroke?
Oh, a little over a year ago.
Wow. And did you get attention right away, or did you wait, or what was your story?
Well, I was out putzing around the garage when I had my cars when I had a pain in the back of my head, and I passed out. My wife found me about 5 to 10 minutes later, immediately recognized a stroke, called 911. They came and they confirmed it. They had called back to the hospital, local hospital, a very small hospital, and they had Arkansas Saves, R-Saves. That's the teleconferencing network for strokes in Arkansas on the phone by the time I got there. So
wow.
Probably 40 minutes I was treated definitively there, and then put in an ambulance, rushed down to the University of Arkansas for Medical Sciences, 75 miles away in Little Rock, and they did an incredible procedure, and I began to make rapid improvement. And the next morning, I was ready to go home. And
wow.
The doctor that treated me was an Argentinian, and I told him I could walk, and he said, "Well, let's see." And I got up and did the Ali shuffle. And he said, "Okay, you can go home." And a day and a half after a massive, massive stroke, I was out and making rapid progress.
Wow. The fact that you told us it was a massive stroke, I think says a lot. Doctor, is Lieutenant Crocker an unusual case, or are you seeing more cases like his?
Yeah, the great news is that, as in the case in General Crocker, we've come a long way in terms of the treatments that can be offered for patients with acute stroke. The key, like in the General's case, was the rapid recognition of his symptoms and concern for stroke, and then getting him to appropriate medical attention very, very quickly, so that the diagnosis could be confirmed and that treatment could be initiated.
And is it's up to us, though, right? I mean, it doesn't happen automatically, or am I wrong about that?
In terms of the recognition and the diagnosis.
Yeah, it sounded like his wife played a key role there. I guess is what I'm trying to say.
Yeah,
we have to know, right?
That's right. So I was very fortunate that his wife was there, recognized right away. There are typical signs for stroke that can be recognized by a bystander or a family member. An easy acronym for your audience to know is the FAST acronym, which stands for face, arm, speech, and then the T is for time, just going back to that issue of timeliness. So So the bystander will look for asymmetry of the face. So you can ask if the patient can to smile and look for droop on one side of the face. Look for weakness of the arm on one side of the body. So, ask the patient to lift, or you can actually lift up both of their arms and see if one of them drifts down or one of them is paralyzed. In terms of speech, you just simply ask the patient to repeat a simple phrase like "you can't teach an old dog new tricks." Mm-hmm. If their speech is slurred or they're unable to repeat, any of those three signs are fairly specific and very sensitive for stroke. And then the T, of course, is remembering that this is time sensitive. So as in the case of the Lieutenant General, you need to call 911, and the patient needs to be brought to a hospital capable of treating acute stroke very, very rapidly. In the general case, what was terrific is that they had this telemedicine linkage to University of Arkansas to expedite the diagnosis and treatment.
And what is telemedicine?
Yeah, so telemedicine, or in terms of stroke, sometimes we call it telestroke, is typically where there's a cart that is stationed in the emergency room, and that can be placed or positioned at the foot of the patient's bed, and there'll be a computer and a camera on the cart, and a remote physician, located at a distance, can then do a virtual exam of the patient through the video camera on the cart. So there'll be a two-way audio-video connection, and an examination can be done by the remote stroke specialist, usually the neurologist, to confirm the diagnosis. In addition, typically in an acute stroke, there's imaging that's done rapidly of the brain, which is usually a CT or CAT scan, and those images can be transferred. So again, that remote stroke specialist can see the patient, interact with the patient virtually, review the images, and confirm the diagnosis and start any necessary treatment at that point.
Oh my goodness, that's a great improvement from probably just a few years ago. This is new, right?
Relatively new. I mean, it goes back probably the first telestroke experience goes back to about 2003.
Oh, wow, okay.
So it's been going on for about 10 years, but it's really, really grown over the last 5 to 10 years. So where in the early 2000s it was quite novel, it's becoming, in many cases, the standard of care when you can't have a stroke specialist at the bedside to use a telemedicine or a telestroke system to kind of replicate the experience of having that stroke expert at the bedside.
Doctor, when General Crocker told us his story, the first thing he noticed was a pain in the back of his head. Had he not passed out and instead wanted to treat that pain with aspirin, would that have been a mistake, or is that a good thing?
That would have been a mistake. Yeah. So I mean, it may be okay, although it's not to give a small dose of aspirin. The key is you really need to get to an emergency room as fast as possible to confirm the diagnosis and get further treatment. You need to have brain imaging done, a CAT scan, to make certain that these symptoms are from what we call an ischemic stroke, as opposed to a hemorrhagic stroke where there's bleeding into the brain, and there may be an expert may have a sense one way or another by evaluating a patient, but an imaging test has to be done.
And does a stroke affect just a specific age group, or is that for any age person can get a stroke?
Yeah, that's a great question. So definitely the risk of stroke, increases with age. Having said that, it's more and more commonly recognized that strokes can occur in young patients. So probably about 1 in 10 strokes occur in people under the age of 50 years old. So there are about 800,000 strokes per year, we estimate, in the United States. So you can do that and say about 80,000 strokes are affecting people in their younger years, in their younger ages each year. So a stroke can happen at any age, but it is more common as we get older.
Before we say goodbye, Lieutenant, I was General. I'm so sorry I was referring to you, Lieutenant. I'm terrible with military titles. I don't want to seem disrespectful. So General Crocker, first of all, my apologies, but I wanted to ask you, how are you doing now? Are you completely recovered?
Not completely. I have a slight less strength in my right side. But I skied last year. I snow skied. I don't run anymore, but I walk 3.5 miles a day, and you would never tell.
Wow.
Looking at me, watching me walk, watching me activity, that I've had a stroke.
Wow, what an inspiration. Doctor, do you want to leave us with a website?
Yeah, so if your listeners are interested in getting more information about the risk factors, the diagnosis, and treatment of stroke, they can go to something called strokeawareness.com.
Okay.
And the Stroke Awareness Day is October 29th this month.
Yes.
All right, just before Halloween. Dr. Switzer and Lieutenant General George Crocker, thank you both for being on the air and for doing the radio tour. It's going to help a lot of people.
Thank you for
hosting.
You're
Very welcome.
All right, we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Coastal flood advisories remain in effect into the evening at the beaches. Watch for rough surf and dangerous rip currents. Tuesday will start with a morning shower, otherwise a mix of sun and clouds with a high of 84 to 88. And Tuesday night will be partly cloudy, lows in the mid to upper 60s, inland 72 along the coast. Wednesday